Due to popular demand, I'm going to create a series where I teach you how to properly and effectively summarize patient cases. And this is one of the most important skills that you can learn as a healthcare professional, especially if you're in medical school, residency, or even fellowship, especially as a consultant staff when you're seeking advice or handing over patient summary or patient case to a different physician taking over. The ability to transmit the critical information of the patient you're looking after to another healthcare team member is vital, is so critical. Medical error is the third leading cause in the United States. And one of the biggest factors that go into causing these medical errors is during the handover time. And there's a lot of studies that have shown this, where the handover period is so crucial, and they've created different ways to standardize the handover of patient information. But the inability to hand over critical pieces of information is what gets lost when patient care gets transmitted from nurse to nurse or doctor to doctor or resident to resident. And so knowing and learning this skill is, I think, of utmost importance, especially if you're in the healthcare field, and especially if you're going to be medical student, resident, or consultant physician at some point. This video, I'm going to describe the template that I would like you to use to summarize cases and use that as a general principle, guiding principle. And then later in the series, I will provide subsequent videos where I will provide you a case, I'll allow you the chance to create the summaries, and then I'll tell you how I would summarize the case. And together, we'll learn how to summarize increasingly complex cases until you're an expert. And so that's what you're going to get out of the series. First, let me start off with the template. As a medical student or a resident, you're going to be taking a lot of patient histories. And you will find that majority of the patients will not answer your question directly. And this is to no fault of the patient. This is kind of the experience of the patient. When you ask them about abdominal pain, the patient, you ask them, when did the pain start? Sometimes you'll get a straight answer. It's like, hey, it started yesterday. If it's more chronic or long-term, patients don't know. Or they just know their life events. They're like, actually, yeah, I was traveling and then I came back and then I noticed the next morning after like not sleeping and maybe not eating, I had some stomach ache, but then it went away and then it kind of started again. And so oftentimes you'll get this long-winded answer, but there are pearls in that answer. And so your first job is to filter the information. So filter is the first thing you need to remember, is a key principle. You will get a lot of information, but you need to filter. And the only way you can filter is to go in with an idea of what you want to seek, what answers you're going to be looking for. And so if you're going with abdominal pain, there are a few key diagnoses you want to know about abdominal pain that, one, are going to be life-threatening. So you want to rule that out right off the bat. And, for example, if someone has a pregnant or has spontaneous abortion, you want to find out pretty quickly. And so you're going to be filtering out some questions and answers right off the bat to see if that's what they have. So filter is number one. Number two is consolidate. So after you filter all the information, you ask about abdominal pain, the patient's like, oh yes, I have pain in the left lower quadrant. It radiates to the back. The pain is sharp and stabbing. It's been getting worse. I have diarrhea. I have vomiting. So these are some of the information you're going to collect. You filter all of that and you consolidate into a coherent story, into something that makes sense. So then that's going to help then shape in terms of where the diagnosis goes and then where the treatment plan goes. So filter, then consolidate. After you consolidate, the third thing where a lot of people trip up, especially if you're a medical student or resident early in training, is interpretation. So after you've gathered all this information, which is what you learn in medical school, and you become really good at gathering medical information by the end of it, that's awesome. But the next step is to actually consolidate and then interpret the information. Can you put all of that, information that you took, can you put it together and create some sort of a diagnosis or a differential diagnosis? A differential diagnosis is just, what are 3 to 5 diagnoses that could potentially coexist or are the leading diagnosis for this patient. So for this lady who has abdominal pain, for example, started about a day ago, now has vomiting, has some diarrhea, left lower quadrant pain. It could be viral gastroenteritis, it could be diverticulitis, it could be pregnancy. And so these are your diagnoses. So this is how you start to interpret the data that you've consolidated from your patient. Okay, so that's number 3. Filter, consolidate, interpret, and then lastly, you want to synthesize. And this is the most important. After you interpret the data, you have a kind of a semblance of what's going on and what the next steps are going to be. And this is where synthesize comes in. Now you synthesize all of the data you took in the filter section and consolidate section, and you pare it down to the core features. For example, if it's, the lady coming in with abdominal pain, one of the things you might have identified is that she had uncooked chicken about a week ago when she went camping. So now that actually is important information that you filtered and consolidated, and then you synthesize that into a story. You would say 20-year-old female who comes in with acute onset left lower quadrant abdominal pain, nausea and vomiting and diarrhea in the context of having uncooked chicken on a camping trip a week ago. The plan will be to admit her for IV fluids and supportive care. And there you go. There are 2 sentences. You were able to convey the patient's story and the important elements of why the patient's here and what we need to be doing to take care of her. Synthesizing is the last important stuff, and interpretation is usually where a lot of people falter because they don't want to put their hat on something in the fear of being wrong. And because of that fear, most people don't learn, because then you kind of put your hat on multiple things and you don't really commit to the proper interpretation of the data that you collected from your patient. So again, summarizing the template: filter, consolidate, interpret, and then synthesize the data together to create a very effective case summary that you'll be able to transmit any patient data or key information in 2 or 3 sentences, whether it's handing over on call, whether it's nursing report, or any other scenario in the healthcare field. Follow, comment, and stay tuned for more case summaries.